Hello guys, welcome back to my channel, and this is part 3 for the investigation methods of KROK. Let's start wherever we have left off. So let's go to the next question. Next question says the pain attack in the right subcostal area, ecteric skin and sclera, light colored stool because of the lack of bilirubin, a dark color urine because the bilirubin is getting conjugated bilirubin is lacking through the urine. That's why the urine color is dark here. Abdomen is distended and painful on palpation. The right subcostal area is liver is enlarged by 2.3. Total bilirubin is high. They have given 90 is high. Conjugated bilirubin is 60. Method of examination. So in most of the question I have told you that you have to go with the ultrasonographic investigations or ultrasound investigations. In this question we will go with the retrograde cholangiopancreatography because let's see why. Because pain attack in the right subcostal area. So pain when the pain attack is there, the attack of pain is there. So in those cases we are most probably sure that there will be probably stone over there. So we will try to go with the retrograde cholangiopancreatography. So why in this case ERCP is more better than USG? Because ERCP will show the bile and pancreatic ducts clearly, and it will help in the diagnosis plus the treatment if there is any stone. So if we have the treatment, we have the duct inside there, so we can remove this stone and place any stent if required. So better in some cases when the bilirubin is given high in the question and stools are clay colored. So we suspect the the obstruction of the bile flow, and that's why in this case we will go with the retrograde cholangiopancreatography. So try to remember this case. This is important case. Let's go to the next patient. Next patient says about the acute urinary retention. So for the acute urinary retention, the man says prostate adenoma and the direct inguinal hernia after surgery, absent urination. So absent urination when is there, so we will do the catheterization. So first of all will be catheterization in order to relax the patient, so that he can urinate finally, because he is having the enlarged urinary bladder. So next question, 108. Patient is 3 hours after the trauma. The patient has bradycardia. Bradycardia, it is severe. 46 is really severe. And anisocoria. Anisocoria is the sign of one dilated pupil. So hemihyperreflexia, one-sided body reflexes are lower. And hemihyperparesthesia, so one side of the body is feeling the paralysis on the left, as they say. And convulsive disorder. So convulsive disorder is something like a seizures. So the patient stays still and do not blink well. So examination method. So why brain CT is important here? Because anisocoria is the sign of brain herniation, or bradycardia is a part of Cushing triad. I'll explain the Cushing triad later. But a thing to remember here is anisocoria is the sign of brain herniation. So if we will go with the CT, we will be able to diagnose the hernia well, and will be able to give the best treatment to the patient. Let's see the next patient. So next patient says about the renal tumors. So for renal tumor, we know that we'll go with the spiral computed tomography. You can read the question 109. I will go next now. There is in question 110. So 7-year-old girl says treated for the UTI twice. So she has a reoccurrence of the leukocyturia and bacteriuria. And so we want to the examination to detect the cause of UTI. So there is the cause of UTI, or to check the vesiculo-rectal reflex, which is the backflow of the urine. Simply the reflex means the backflow of the urine. So the examination, when the examiner asks about the examination to detect the cause of UTI, so to detect this reflex, we are going to do the micturating cystourethropography. I'll collect them in the last photo. So let's go next. Next patient is 10 hours after the birth. Child developed jaundice, hypotonia, hyporeflexia, moderate hepatosplenomegaly. Feces and urine are normal color. Umbilical cord bilirubin levels are 51. Mother is Rh negative and fetus is Rh positive. So this is a case of the hemolytic disease of the newborn. I have written here. So hemolytic disease of newborn. So the Rh incompatibility case. So this is immune mediated hemolysis, which is also known as. So in such cases we go with the Coombs test. Coombs test can detect or confirm it that if the Rh incompatibility is really present there. So this question, next patient, you might have seen this question a lot of times, so you would have remembered it already. So uterine fundus when located at the level of navel, term is 24 weeks according to KROK. In reality it is somewhere around 20 or 21 weeks, but it's okay, it's the nearby correct answer, that when the uterine fundus is located near to the level of navel, the term is 24. So let's go to the next patient. Next patient says 45-year-old patient, general weakness, body temperature raise, excessive sweating, enlarged cervical lymph nodes. Temperature is 37, skin is pale and dry. Posterior cervical lymph nodes are dense and elastic, 2 cm, no peculiarities in the heart and splenomegaly. So the best way to check here the enlarged cervical lymph nodes. So in this question, this is the profile for the either some of them, chronic lymphoid leukemia or any autoimmune pathology is there or any infection is there. So I'll make new video over the acute or chronic leukemia, but for here you can remember that when there is no peculiarities are in the heart, lungs, and other things are not there, so the cause of the problem can be leukemia or other these which I have seen. So in this case we are doing the computed tomography. Next is the abnormal uterine bleeding. So for the abnormal uterine bleeding, we are going to use the transvaginal ultrasound method. So transvaginal ultrasound method, it's a camera. Camera is inserted inside the vaginal opening, and through the camera we are going to check what is the exact problem, and hence followed by the laparoscopy or whatever the treatment is required by the patient. So next question is 115. So the patient has a close trauma of the urinary bladder. So in this case we are going to do the retrograde cystography or cystourethrophy, and let's see the next patient. So for the tubal infertility we are choosing the laparoscopy with the chromosalpingography this time. So tubal infertility means the problem with the fallopian tube, the problem with the there is any kind of problem due to which the patient is infertile, they cannot have pregnancy. So this is laparoscopy. Laparoscopy we will choose. Why? In order to check what is the main cause inside there. Infertility is diagnosed already, so no need to use contrast or anything. So main is laparoscopy. We will open or reach to the infertility spot, and we will with the chromosalpingography. So next is asbestosis. So we know about the lung pathologies. Asbestosis I have explained in the social medicine video, so we will do the chest x-ray for that. Let's go to the next question. Next patient says that the bloody discharges from the genital post-menopause 12 years. External genital organs had signs of age involution. So uterus wasn't, the uterus cervix was erosate. Bloody discharges came from the cervical canal. Uterus is of norm size. Uterine appendages are unpalpable. Fornices were deep and painless. So what method we are going to use at this time? So bloody discharges are there, and the patient already had menopause like 12 years ago. So we are suspecting some cancer over there. Because of the cancer, we know about in the tumor topic I have in the topic tumor I have explained about the causeless bleeding will be most probably cancer, or most of the time it can be endometrial cancer. So we will do the separated diagnostic curettage here. Diagnostic curettage or dilation and curettage also I have included the photo in the shorts, you can watch them. So dilation and curettage, why? Because this is the diagnosis as well as treatment at the same time. So we will take the biopsy, and while while the curettage we will clean up the all the debris or whatever we will see the cancerous thing or atypical cells, we can clear them. So next is the case of chronic viral hepatitis B. So for the viral hepatitis B, we know about it, transaminase test, or let's say ALT, AST, so alanine aminotransferase or aspartate aminotransferase. So in the question, the option was given was transaminase. So the choice of treatment is transaminase test. So it says sometimes ALT, sometimes it says SGOT, sometimes it says the transaminase test. So try to remember the things. All of them are related to the hepatitis B or A or any kind of hepatitis. So they are all the liver function tests. So something to remember here. So when the persons are occupational people are exposed to the electromagnetic wave of the high frequency, so they are dangerous for the visual analyzer, so they are dangerous for the eyes. So this is highlighted well, I hope you will remember it. So electromagnetic waves are causing problem with the visual analyzer, so eye problems. So let's go to the next patient. Next patient says that there is hyperparesthesia, the intractable vomiting, he is having fever, he is having high heart rate and BP, hyperreflexia, convulsions. So either this question is trying to indicate the meningitis or maybe encephalitis, or this question is trying to indicate by the way they are not really the symptoms of subarachnoid hemorrhage. Because the question will provide severe headache for sure in the cases for the subarachnoid hemorrhage. So anyhow, if meningitis is there, so we are going to choose the lumbar puncture for that. So next question is a bit difficult because we can mark a bit the question incorrect. So let's read it. When helping a man with the bleeding, the physician pricked his own finger. The patient is an injecting drug abuser who underwent for the HIV test. Results are unknown, and what measures should the doctor take? So the patient is already diagnosed for HIV, but in the answer, if you don't want to mark incorrect, just remember it that process the contaminated skin area and test the patient for HIV again. However, the patient has been diagnosed already for the HIV test, but still the examiner want to hear from you that you will do the test from the patient again, because maybe if the patient is lying or something like that, maybe we can remember this way. So process the contaminated skin area, test the patient for the HIV, and then start the chemoprophylaxis. So in the next question is a 18-year-old girl has sneezing attack in the morning 15-20 times each in the nose, throat, profuse watery discharges from her nose, rhinitis and pain in her eyes. So the question is screaming for the allergic rhinitis. They are the symptoms of allergic rhinitis directly, or let's say any kind of general allergy. So we are going to perform the skin prick test. So in the first video I have shown you the photo of skin prick test. You can watch it, in which the doctor used to take the possible allergens and try to inject them into the skin of the patient. So we will come to know the results that wherever the mark is edematous, so the patient is allergic to those compounds or those allergens, so shouldn't contact them. So next patient is 1-year-old child. The case of upper respiratory tract infection, suddenly developed noisy respiration with difficult inspiration, intercostal retraction, barking cough. Barking cough, when the question is saying, so that's the problem is with the stenotic laryngotracheitis. So the question will say a lot of things like barking cough, or sometimes loud breathing also the question will say, or sometimes hoarse voice. So any time whenever you see the problems with the larynx, so problem with the voice are related to the larynx, the laryngeal cord. And only one case I have seen that there was a case of quincke edema. In that case there was the answer was not the stenotic laryngotracheitis. So if I'll find the question, I'll try to include it in the comment box. So let's go to the next patient. Next patient is a 17-year-old patient tries to begin the sex life. Recommendations for such patient. So the important thing is the prevention of the human papilloma virus. So we can tell to the patient that before the beginning of her sex life, she can have a vaccination against the human papilloma virus. So there will be no complication and no problems with the sex life of the patient. Let's go to the next patient. Next patient is 20-year-old patient. After failing in the exam, complains of sensation in the round body, in the throat, and difficult swallowing. She fixates on her child, limits her diet, and often cries, seek attention, exhibit demonstrative attitude, highly susceptible to the psychosuggestions and psychiatric diagnosis. So so this is the case of the hysterical neurosis. So what happens is the symptoms whichever the patient is feeling, she failed an exam, so this is the stress factor for her. So sometimes due to the stress factors provokes the hysterical neurosis, which is the functional neurological symptom disorder in DSM-5. I have written it here. So in the end, so this is the gene problem, DSM-5. So it is characterized by the presence of physical symptoms and which are not fully explained in the medical terms. So she got the stress factors which provokes the hysterical neurosis, that she failed the exam, and after that she feel the foreign body in her throat. However, she did not really had this, but this is just a kind of illusion type of thing. So just remember, the stress factor can provoke such things. So yeah, in the end, this is the photo showing all the problems whichever we see with the renal system. So since we can mark them incorrect because a lot of diagnostic factors for the kidney things. So let's read out them one more time. The double pilocalcial system, when it says, so we'll do the excretory urography. When they want to know the cause of UTI, so we will do micturating cystourethropy. When they want to detect the renal tumor, so we'll go with the spiral computed tomography. When there is any closed trauma of the bladder, so we will do retrograde cystourethropy. I have made a short trick about the trauma as well. So the R of the trauma highlights the retrograde cystourethropy. So this is it with this video. Hope you enjoyed the videos and hope you find them helpful. So if still there is some mistake which you are doing in the questions, so let me know in the comment box, and have a good evening. See you in the next video.